Today, what I really want to discuss is how we can work together moving forward. Um, there's, we're in a time of a lot of polarization around politics and around a lot of these COVID sort of issues that it seems like a lot of our leadership is actually trying to divide us. And what I want to do today is try to make some bridging between the folks that are vaccinated and the folks that are unvaccinated. So, and public health is the kind of on the broad level, statewide, nationally, has really put a lot of focus in trying to convince unvaccinated people to kind of do the right thing and get the shot. And I want to shift this discussion a little bit today and look at what we know about the people that aren't getting vaccinated, and so that we can have more understanding and maybe less polarization, less treating them like the other and like they're not making good decisions, so that we can work together to prepare as a community really for the next surge. So as Sarah's pointed out in the past, in Lake County, the highest number of unvaccinated people tend to be white, non-Hispanic, and also the adolescent group. So now adolescents tend to not get as sick, but they can lead to spread in the community. And definitely when there are positive cases in the schools have to start shutting classes down and doing a lot of contact tracing. And so it really interferes with the learning experience. And if everybody remembers, a year ago, we tended to have most of the schools were not even open. And now it's very challenging for the schools and the leadership there to keep them functioning. And the fewer cases we have in the schools, the better it's going to be, and vaccination helps that. So there was a big article that came out in the New York Times recently that talked a lot about unvaccinated folks and this is all national level, but I think it really helps us think about it in Lake County. In the U.S., almost 95% of those people over 65 are vaccinated. So, and this is a little bit surprising because of some of the stereotypes of who's unvaccinated, because often the older Americans tend to be Republican. A lot of them watch Fox News. A lot of them receive a lot of the disinformation, yet they're still going ahead and getting vaccinated because their perception of risk versus benefit is in their favor. So, and this is really important, to get those older folks vaccinated is how one of the ways to prevent deaths and prevent overwhelming of the hospitals. And if you look at the nursing homes, a year ago now, we were continually dealing with outbreaks in the nursing homes, and it was pretty overwhelming. And now there's very little cases in the nursing homes. We do have one small outbreak now in one of them, but it seems to be contained at this point. And it's and this is all because of the vaccination. So because pretty much everybody in the nursing home, all the residents are vaccinated at this point. The research shows that there are two groups of unvaccinated people in the country. One is vaccine resistant, and so these are the people that have very deep-seated views, and it's really important to their identity and their group that they're hanging out with to not get vaccinated. And then there's the vaccine hesitant, and these are the people that have concerns, but they're willing to consider vaccination, and they're just trying to sort of sort through everything. And it seems like the numbers are maybe 50-50 in terms of the unvaccinated people, whether they're in this very deeply held belief system versus just trying to sort out how to go through it safely. Employer vaccine mandates seem to be increasing the percentage of people getting vaccinated. So this is we weren't really sure how this was going to work out. And so, but even though many people said they were going to quit their jobs if they were going to be forced to get vaccinated, the vast majority ended up going ahead and getting the shots when mandated. So these are folks that we would kind of call vaccine hesitant. Once they were kind of pushed, they were willing to go ahead and get the shots, and it seems to be improving the numbers in certain communities. So some of the concerns that people are expressing that are leading them to be hesitant about getting vaccinated, I'm going to kind of walk through those a little bit, but you can see that a lot of these are pretty pretty darn reasonable, and maybe we can try to address them and make people more comfortable with moving ahead and getting the shots. I think part of this is it's less kind of lecturing to people and more about trying to set up the situation so that they can end up feeling more comfortable with going ahead and making the decision. So one of the big characteristics that they found is people that are not vaccinated tend to not be trusting of institutions and authorities. So these under 40% of the unvaccinated said they trusted hospitals and doctors a lot. And whereas the people that were vaccinated, it was over 80% of those folks said that they trusted doctors and hospitals a lot. So these unvaccinated folks don't trust the information they're getting from the public health world. So me kind of going on and on about data and figures probably isn't going to help people change their mind a lot in that situation. The research has really showed that the unvaccinated people are really the kind of primary thing is that they're unsure that it's safe. That's what's leading to them being hesitant. They're not really necessarily concerned about broader conspiracy theories, but it's really a safety issue and what's going to happen to their health and the health of their family. And an interesting data point was that only 12% of the people that were unvaccinated said they didn't think they would benefit from the vaccine. So that means almost 90% of these folks that haven't gotten vaccinated really feel that they would benefit from the vaccine, but they're really more concerned about the risks. And young pregnant women are an area of real concern right now in the public health community because it's clear that COVID infection makes them much more at risk of bad outcomes. And there's a lot of stories now of women during late pregnancy or at delivery that end up dying from COVID-related causes, and now their baby doesn't have a mother because of just some of the complications of pregnancy with COVID. So yet only a third of young pregnant women are currently vaccinated. And so there's a big push now to try to get these women vaccinated as quickly as possible. But for sure, they're worried about the risk to the baby, and kind of the unknowns of the vaccine make them delay getting the vaccination. But then with the risk being so much greater, the outcome can be, disastrous. So this again just kind of points to the concerns about risk versus benefit. Fear of needles in about 20% of adults seems to be contributing to not wanting to get vaccinated in some people. And so in other countries, they're actually finding ways to accommodate people with fears of needle sticks. So more private rooms, more kind of just helping them feel more comfortable with the needle stick. But again, most of it seems to be around concerns about the long-term impacts of the vaccine. And so we're pretty sure that most of the bad effects, any of the bad outcomes are happening pretty quickly after the vaccine. So vaccination injuries don't seem to be long-term in terms of you don't see them for many months down the road. The vast majority, this is true for all vaccines, that seems to happen soon afterwards. And if you get through the first several weeks or so without any problems, you're probably going to be okay. So this is something, but because of concerns about long-term side effects from medications, I think people are sort of mixing it up a little bit. And even though they are looking around and seeing that the vast majority of people are doing fine 6 months down the road, they're still worried about some possible long-term effects. And that's probably not going to happen. So, basically what we can see is there's a complex mix of reasons that people haven't gotten vaccinated. I guess the thing I'm trying to sort of emphasize here is that a lot of these are fairly reasonable, and these people are kind of looking out for their own health and the health of their family. And so even though in the public health community, we think the risk of the vaccine is much lower than the risk of COVID, and that if we can really kind of stop this from spreading through vaccination, people are going to be a lot better off. I think a lot of people are making choices for themselves and their family that are at least reasonable from the way they're looking at it. So I want to really try to decrease the divisiveness here, and that sort of picture that gets painted sometimes of all unvaccinated people. They're kind of selfish, and they're kind of taking these disinformation on the internet to extremes. I think people are really choosing based on the information they have at hand and that they trust. And I think we should try to all work together on this moving forward and really talk about the community health so that even if people do need to continue to avoid vaccination for whatever reason, that they can adopt some of the other safety measures to keep the rest of the people safe. So I do want to just review how to get a shot. So a vaccine is readily available at most of the pharmacies. Many of the healthcare providers still give vaccine. We do still have the vaccine ban, at least for a couple more weeks. So that's available, and you can go online and find out about that. And if somebody in your family is homebound and can't get out, you can contact the health department, and we can get to a lot of places to help people get their shots. There's also some community outreach. The Heroes of Health and Safety was yesterday at the fairgrounds, and COVID and flu vaccine was available there. And there's some other community outreach programs that are ongoing over the upcoming weeks. Third doses are available for people who got Pfizer and their second dose was at least 6 months ago. Moderna and J&J are in the pipeline to get approved in the near future, and I expect that to happen probably before Thanksgiving. The schools are dealing with cases a lot now, and like I said before, it's really disruptive to have the school cases showing up in the schools, and so really encouraging school-age kids to get the shots. And we anticipate the children 5 and older will be approved for vaccination probably within the next couple of weeks. So kind of overall and in conclusion, I just want to say that we all have to work together here. Being real polarized and kind of on opposite sides of the argument really isn't helping anybody, I don't think. And I think, preventative measures like a healthy lifestyle and a good diet are great ideas. They're always a good idea, and certainly in this situation. But I don't think that's enough. There are some treatments for people when they do get sick, and monoclonal antibodies and remdesivir are available now, and there's a new medication a pill that they're talking about trying to get available here in the near future that helps people that are already infected, prevent severe outcomes. So we'll see if that's working its way through the approval process. But, really our best hope is to continue our public health efforts, the vaccines, which we've been talking a lot about today, and the testing and quarantine when you're close contact and work overnight. Taking action has a higher risk, but if you or your family is choosing not to get vaccinated, then please be considerate of the rest of your family and your neighbors, and wear your mask when you're indoors, stay home if you're sick, and really talk to your medical provider if you have concerns that are preventing you from getting the vaccine, and that you have questions or concerns that maybe we can help you with. And again, thank you for all the work. We're really excited that there's over 60% of people vaccinated in the county, and we're hoping that that's going to prevent the really bad outcomes here if and when we do have another surge, and keep kind of wearing masks and working with us on this, and hopefully we'll get through the winter in an okay state. So thank you very much.